everyone. Thanks for watching my vlog, A Dose of Reason. I'm Dr. Shira Doron, an infectious disease physician and the hospital epidemiologist at Tufts Medical Center in Boston. For the past 8 months, I've looked forward to answering your questions about the COVID-19 pandemic and sharing my thoughts on the latest news and scientific updates and breakthroughs so you can make the best health and safety decisions for you and your family. You can send me your questions to adoseofreason@tuftsmedicalcenter.org. Please include your first name and hometown with your question. I'll pick a few questions to discuss in the next vlog. Well, it's been 2 weeks since we last met and a lot has happened. Unfortunately, cases are on the upswing in the US, while hospitalizations are pretty flat and deaths continue to fall. Sadly, we're closing in on 1 million US deaths from COVID-19. In the Boston area, wastewater levels have pretty clearly peaked from the small bump we saw related to the BA.2 subvariant of Omicron. Cases in the state are at least flat, but always hard to interpret given how many people are testing at home. There have been varying responses to the increased cases. In Philadelphia, the mask mandate came back for 4 days and then was dropped again. I think we can all agree that if the metric means masks go on and off and on and off with that kind of frequency, it's not going to be sustainable. I heard about a school district in New Jersey that went remote. At this point, I think that's just totally unacceptable. Data are increasingly showing that the learning loss and isolation associated with remote school has been extremely detrimental. Our first question is from Brittany from Mobile, Alabama. Should people under 50 get a second COVID booster? I'm worried because my initial 2 doses and my first booster shot were all Pfizer, and everyone I know who was triple vaccinated and ended up in the hospital all had Pfizer. I thought Pfizer and Moderna were the same. Brittany, the headlines are incredibly confusing. I understand why people are nervous. Here's what we know. People who got 3 doses of Pfizer or Moderna, or people who got 1 or 2 doses of J&J plus a Pfizer or Moderna, are extremely well protected against hospitalization and death. Extremely well. Now, you'll see studies showing a variety of numbers representing VE, that's vaccine effectiveness, as a percentage. Now, generally, that percentage is the decrease in infections in that vaccinated group compared to a comparator group, which might be unvaccinated people, or in the case of a booster, the comparison group is often double vaccinated people, or in the case of a second booster, triple vaccinated people. So why do we keep seeing different numbers for VE and different studies and different headlines? Well, it turns out it's extremely hard to measure VE, and it's only getting harder. One reason is that the comparison group is increasingly getting infected, sometimes more than once. And infection actually protects well against infection, hospitalization, and death, especially in the short term. So that's going to make vaccines look less effective or even ineffective. It's amazing that we see any VE at all anymore in the vaccinated group, frankly, and any non-zero number tells us how amazing the vaccines are. Now, in any VE study, you need the number infected and the number uninfected. But what if people who are unvaccinated are also less likely to get tested? That's going to make the vaccines look pretty ineffective, even though they are effective. So there are some ways that the studies deal with that bias, but that's also going to make the numbers really differ between different studies depending on how they adjust for that. So here's what I want to say. Stop reading the headlines. Trust your vaccine. When the CDC's advisory committee says it's time to get another shot, that's when you should get another shot. And until then, please do the things that are important to you and know your risk is low if you're vaccinated and boosted. For those who are eligible for a second booster, the CDC has released a new guidance document that you can use to help you decide whether to get the booster now or wait a while. Our second question comes from Stephen from Gloucester. With so many people using rapid at-home COVID testing, is the positive percentage data basically useless at this point? If so, what is the best way to measure COVID going forward? Yes, I think it's basically useless. And I think this is why the US was so slow to ramp up home testing. So I think home testing is important and I'm glad we have it, but we have lost the ability to count cases. And the percent positivity, which was always a metric intended to assess our adequacy of testing, how many cases are we missing, has lost meaning. So how do we know where we are with COVID and how careful we need to be? Well, we have the CDC community levels. Those are updated every week. We can see that some high counties have popped up here in the Northeast, but it's still less than 2% of the country. And because that framework uses hospitalizations and hospital capacity, many people rightly say it's not adequate to tell them how to act on a day-to-day basis, how much COVID is out there. So if you're someone who wants to wear a mask when cases are higher and not wear one when cases are lower, you might not want to wait for hospitalizations to change your county's color on the CDC map. But there's not a great solution for that. Where wastewater surveillance is being performed, you can get a much better idea of trends than case counts will give you at this point. Of course, wastewater surveillance can't happen where people are using septic systems. Here's a map showing 848 sites where wastewater surveillance is being done across the country and reported to CDC, color-coded by level and showing the changes over the last 7 days. This might be useful to you. Our last question comes from Ellie from Providence, Rhode Island. I know you've addressed this question before, but any updates on when we will finally have a COVID-19 vaccine for children under 5? So many of us with young children are getting increasingly frustrated, especially with the summer months approaching. This week, there were stories swirling that FDA officials were considering delaying authorization of the pediatric vaccine until both companies had submitted data. That didn't sit well with a lot of parents, and for good reason. Moderna finished its 2-dose vaccine trial for children under 6, and they're about to file their application. Pfizer has not finished because their 2-dose trial failed and they had to convert it to a 3-dose trial. They may be ready next month. So why would the FDA not review the Moderna application as soon as it's ready, and then the Pfizer one when that one is ready? Just the same way they reviewed Pfizer first and then Moderna for the adult authorization? Well, one reason given to the press was that the effectiveness of the Moderna 2-dose shot doesn't look that great. And what if people rush out to vaccinate their kids with Moderna and it turns out the 3-dose Pfizer vaccine, which will be available maybe a few weeks later, is better? According to Politico, they're worried about backlash from parents and in turn, a worsening of vaccine hesitancy, which they already expect will be high in this age group. It's quite a mess, but I have some good news. This week, the FDA authorized the antiviral drug remdesivir for children as young as 28 days old. If your child has any risk factors at all and gets COVID, call your doctor right away to talk about remdesivir. In adults, we know remdesivir is nearly 90% effective at preventing progression to hospitalization. That's all the time we have for this week. You can send me your questions about the recent uptick in COVID cases, masking, COVID treatments, or anything else related to the pandemic or infectious diseases to adoseofreason@tuftsmedicalcenter.org. I look forward to dishing out a dose of reason to you again in 2 weeks.